Good afternoon, everyone. Welcome to today's update on COVID-19. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for Alberta. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon. Today, I'd like to provide an update on COVID-19 in the province, talk a bit about Alberta's outbreak strategy, and announce updated measures we are putting in place to balance the needs of continuing care residents against the need to prevent spread of COVID-19. Based on 5,205 new test results over the last 24 hours, we have confirmed an additional 315 cases, bringing the total in Alberta to 5,165. I'm pleased to report the number of recovered cases in Alberta has now reached 1,953. Sadly, we have also confirmed 7 additional deaths. This means there have now been 87 deaths in our province. All 7 deaths reported today come from long-term care facilities in Calgary, including 6 at Clifton Manor. I want to emphasize that this sad news is not a reflection of the work that has gone into managing this outbreak at the site, where my local colleagues tell me that the site responded promptly, created an isolation ward, and worked hard to prevent the spread. Despite this shows the power of this virus in a closed environment. My sympathy goes out to the friends and families of all these individuals and all those who live and work at Clifton Manor and any other site that is experiencing and dealing with an outbreak right now. There are now 503 cases in continuing care facilities across the province. As of today, there have been 821 cases confirmed among workers at the Cargill meatpacking plant. There have also been 276 cases confirmed among employees and contractors at the JBS plant in Brooks. We have taken every outbreak seriously and have used our fundamental outbreak control principles to limit spread in settings of concern. We have also continuously refined our strategy to identify and respond to outbreaks based on new learnings about this virus as new information becomes available. Effective outbreak coordination depends on close coordination between multiple partners. To be successful, our outbreak strategy involves 3 elements. The first is prevention and preparedness. We have been using foundational outbreak processes that are in place every year for influenza and other viruses to help high-risk locations and settings, such as continuing care facilities, work camps, and shelters, to alter regular practices so that if a case of COVID were to appear, the chances the virus would spread would be minimized. Alberta Health and Alberta Health Services have worked with these organizations to ensure these practices are changed in order to prevent spread and to be sure that organizations are ready to respond should a case be confirmed. The second element is rapid response and timely notification of Alberta Health Services Public Health. This occurs when an individual in one of these settings, such as continuing care, has symptoms related to COVID, so that even before a case is confirmed, prompt testing can happen and additional controls can be put in place. AHS has set up a toll-free line to make it easy for any operator of any congregate care site in the province to get immediate support and guidance on how to respond to a resident or a staff who have symptoms related to COVID. These early measures make it possible to keep small numbers of cases from becoming larger. Finally, the third element is outbreak management, the actions we implement once an outbreak has been declared. The cornerstones of this stage include identifying all cases and those with symptoms and isolating them from others, assessing individuals who have been exposed and testing and isolating them, using surveillance data to understand the likely source and how the virus is being transmitted, and implementing setting-specific measures to prevent any further transmission from occurring. One particular setting where this strategy is used consistently is for continuing care. Outbreaks in these facilities remain a concern for many, including public health officials, families, operators, staff, and of course the residents of those facilities. At the same time, I have heard that the preventive measures that have been put in place to prevent outbreaks have had negative impacts on the quality of life for many residents. Both of these, outbreak prevention and quality of life, are really important, and as we learn to live with COVID, we need to continue to make adjustments. Today I want to talk about new public health orders that amend existing directives for these kinds of facilities. These orders are designed to ensure continued protection of residents in continuing care facilities, as well as improving their quality of life. First of all, in these facilities, anyone with the mildest symptoms such as a hoarse voice or muscle aches must immediately be tested for COVID-19 and isolated until results come back. In addition, as soon as a COVID-19 case is identified, all residents in the same unit are now tested, even if they are feeling fine and show no symptoms. This has been a recommendation for several weeks, and it is now incorporated into the order to underline the importance of early diagnosis in close contacts in this population. Although testing someone without symptoms is only a snapshot in time and does not stop the need to isolate for 14 days in close contacts of confirmed cases, it can help to identify cases before symptoms start, helping to better control an outbreak. To protect the health of workers, any staff member caring for an isolated resident must also wear eye protection, along with all other appropriate personal protective equipment, including a gown, mask, visor, and gloves. Other measures still remain in place, such as requiring all staff to wear masks through the duration of their shifts in all of these facilities, as well as requiring workers in long-term care and designated supportive living facilities to work at only one location. The measures we have put in place over these last weeks are necessary to protect those in long-term care and other facilities. But I also know they are causing many residents to feel further isolation. This is something that I think about often, and I have heard people's stories. Maintaining connections with family and friends is paramount during the pandemic, especially for residents in continuing care and licensed supportive living settings. To help improve residents' quality of life, as well as recognizing that orders for continuing care facilities may need to be in place for some time, I am issuing a second new order. It will allow residents of these facilities who are not in isolation to enjoy outdoor visits with a designated essential visitor and one other person. These are important to the mental health of residents and families. Of course, even while outside, all appropriate precautions must be taken to prevent exposure to COVID-19. This includes physical distancing and requiring all visitors to wear a mask or face covering. I want to emphasize that restricting visitors into these facilities continues to be necessary to protect the long-term safety of staff, residents, and visitors, especially in facilities with a confirmed outbreak. However, there have been a number of examples where this policy has been applied in a more restrictive way than was intended, particularly for palliative and end-of-life visitation. We expect that individuals who are dying should have the opportunity to have their loved ones at their side, while following the guidance in place to ensure everyone's safety. That is why the orders that I'm announcing today also clarify visitation for circumstances where an Albertan is at the end of their life. The definition of end of life is in the 2 weeks prior to death, acknowledging that these estimates will always be imprecise. It is important, though, that it be clear that end of life is being measured in weeks rather than in days or in hours. Also, up to 2 visitors at a time will be allowed to visit a patient who is dying, as long as physical distancing can be maintained between the visitors. Finally, it should be clarified that standalone hospice facilities are not affected by these orders, and no visitor restrictions are applicable to hospice settings. I'd like to thank the Alberta Health Advocate for bringing this important issue to my attention and for continuing to advocate on behalf of families with a loved one in palliative care. Finally, I have signed a new order specifically for residential addiction treatment facilities. Effective today, we are issuing standards that all residential addiction treatment facilities must follow. Previously, they had to follow the same requirements as continuing care facilities, but their needs are unique. These new measures are intended to prevent the risk of infection while allowing individuals to continue to receive treatment and overcome their addiction. That is why this order allows special accommodations for group therapy and to support the shorter residency of clients. I know outbreaks continue to be a concern for many Albertans. They are for me as well. I want to assure you that we have a comprehensive strategy in place, and aggressive outbreak measures are being implemented across the province, from prevention to outbreak response. This will be a cornerstone of our ability to live with COVID for the foreseeable future, our ability to work together to prevent rapid spread in all settings, but particularly in those that are at the highest risk. I want to end today by taking a moment to address the Albertans evacuating from their communities due to flooding, and the communities who are welcoming their neighbours in this time of need. I want to assure you that the safety of Albertans is our top priority. During emergency situations like this, we must come together to quickly and collectively respond as a community. As long as proper precautions are taken, there is no risk in welcoming evacuees to your communities in their time of need. Thank you, and I'm happy to take questions.
Excellent. Before we go to the phone, just a reminder that in addition to Dr. Hinshaw, we also have Dr. Mark Jaffe, Vice President and Medical Director with AHS. Operator, could you please put through the first question?
First is Carrie Tate with Globe and Mail. Go ahead, Carrie.
Hi, thanks for taking my question. What gives AHS confidence that Cargill's safe to reopen?
So I know that my colleagues, the local medical officers of health in Alberta Health Services, have been a part of on-site inspections and have been working with the Ministry of Labour, who's also been speaking with Alberta Health Services about this. And so my understanding from the information that my colleagues have given me is that this plant in particular has made sure that all measures to prevent spread of infection are being put in place. Again, these measures were enhanced, and so certain settings such as the locker room, for example, there will be additional measures put in place there. And again, based on these on-site inspections and their assessment of the situation, my colleagues at Alberta Health Services have indicated that they feel that these measures are sufficient to prevent the spread of infection.
Operator, could you please put through the next question?
Next is Robert Tuttle with Bloomberg. Go ahead, Robert.
Yeah, I was wondering if you could give us an update on the situation up at the Curl site, and if some of these people work at different sites there. Has there been any spread, or is there a risk of a spread, or are there workers at any other facilities that are being asked to, self-isolate or anything?
So with respect to the Curl Lake outbreak, at this point, given the fact that we've done fairly significant testing, including people who had no symptoms but were tested as a part of the outbreak response, there have been a total of 83 confirmed cases identified. 65 of those are in Alberta, and of those, 33 are on the site. And this particular work site has lots of measures in place to make sure that anyone who's a confirmed case and anyone who has any symptoms are isolated and away from others. And they've also made sure that all of the other workers on site are following appropriate protocols to make sure that the spread of infection is limited. And you may recall that when this outbreak was first identified, we talked about the fact that we did expect that there would be additional cases reported, given that it can take up to 2 weeks from an exposure for cases to become apparent. But my colleagues in the North Zone have been working very closely with this site, and the workers who are on this site who are either close contacts or who are cases or symptomatic are not leaving and going elsewhere. They are in isolation or quarantine as is appropriate. And again, there's strict outbreak control measures in place.
Operator, could you please put through the next question?
Next is Kevin Nimick with CTV Calgary.
Point of
Go ahead,
clarification,
Kevin.
and then I do have a question. Oh, sorry. Hi, Dr. Hinshaw.
Go ahead.
Okay. I just want to start with a point of clarification, and then I do have a question. So right off the top here, the deaths at Clifton Manor, the 6, did they all passed away in the last 24 hours, or are some of the identifying numbers sort of catching up over time? And then the question, mass gatherings are banned until the end of summer, but now the province is looking at starting to reopen the economy in stages beginning in May. So how long will the social distancing rules we currently have in place last?
So with respect to the Clifton Manor, we received a report of several deaths altogether, although some of them had passed away several days prior. So it does sometimes take a little while for reporting to come to the ministry. And so these are deaths that happened over the past week. These are not all deaths that happened in the past 24 hours. With respect to this question about summer events, the important piece of what we all need to be thinking about going forward is how we will learn to live with COVID for the foreseeable future. And so some measures such as remaining 2 meters distant from others and making sure that if we're sick, we stay home, those measures are going to be in place for many, many months to come. And we shouldn't be anticipating that those kinds of measures will be going away. In fact, those are the kinds of measures that will support our ability to consider opening up some businesses. With respect to the mass gatherings part of our measures, again, some of those pieces, such as mass gatherings and other pieces, are all part of the discussion on how we would stage relaunch to make sure that as we open certain sectors or consider opening certain sectors up, we need to be thinking about the impact on spread of the virus, which is still with us. And things like mass gatherings, gatherings of many people, especially in a social setting, is one of the most risky ways of gathering from what we've seen in the outbreaks that we've had and the locations where we've had significant spread from just one infected person. So those are all the factors that we're considering as we're looking at the options in front of us with respect to timing of when we might relax certain restrictions.
Operator, could you put through the next question, please?
Next is Jennifer Lee with CBC. Go ahead, Jennifer.
Thanks. Hi, Dr. Hinshaw. I just wanted to ask you a little bit more about the changes that you are bringing forward in terms of palliative residents. I guess how concerned are you by what you're hearing about continuing care residents who are dying, who haven't been able to have visits from family members, so essentially dying alone? And further to that, I guess I wonder what, with this clarification today in terms of those visitations, what recommendations or advice do you have for long-term care centers in terms of how they can make that happen? Because many of them are struggling with staffing shortages and whatnot. So wondering if you could provide a little bit of clarification on that.
Sure. So I have heard, and again, I mentioned the Office of the Health Advocate, and so there have been instances where people want to visit a loved one who's in one of these facilities where that loved one is near the end of their life. And I think there have been different interpretations where some have understood that the intention of the order was for the last hours of life. And that can be quite difficult because it's difficult to predict when someone will pass away. And so if you're trying to target a very narrow window, such as the last few hours of life, it's very difficult to arrange for visits in that particular window. So my hope is that by clarifying with this 2-week window, I actually hope it will make it easier for loved ones who want to visit, for the resident, and also for the facility, because ideally there's an ability to look at a 2-week window, which again is imprecise, acknowledging none of us have the power to predict the future with such certainty, but looking at that time frame of a few weeks, that it would give the opportunity for the facility to consider how they might support visitors coming in, understanding that there are many that are managing, multiple demands with not always as many staff as they would like to have. So hopefully this will allow for planning to take place and for an ability to make sure that there are processes so that visitors come not all at once and kind of wait one at a time, but perhaps those visits can be staggered over a series of days or weeks. So this is a work in progress, and we'll be happy to continue to hear from families, from residents, from operators, how we can continue to improve our approach to both protect residents in these settings from the introduction of the virus, as well as make sure that families can spend time together and loved ones can spend time together in the last weeks of someone's life.
Operator, could you please put through the next question?
Next is Bill Fortier with CTV. Go ahead, Bill.
Hi, Dr. Hinshaw. I just wanted to ask something about the modeling from yesterday. I noticed that the projected number of deaths was not adjusted, actually was not included in the most recent modeling, and it was on April 8th. So I'm wondering why that is, that the number of deaths wasn't estimated this time, and whether that estimate would still be in line with the previous projection.
So you may recall that the previous projection of deaths was an incredibly wide range. It ranged from several hundred to several thousand. And the problem with modeling out deaths or predicting deaths is it's even more difficult to kind of predict deaths than it is to predict our hospitalization and ICU, because it depends almost entirely on where infection spreads. And if you have many infections in high-risk populations, there will be many more deaths. The fatality rate will be much higher in older people or those with chronic conditions. And the death rate will be lower if the majority of infections are in those who do not have risk factors. So with respect to the modeling adjustment that was made yesterday, really the main focus of the adjustment was looking at health system capacity and what we might anticipate we would need over the coming months. And so the question about how many deaths we might anticipate is not something that we can predict with accuracy. And again, you'll recall such a wide range even in our initial models, that including that in even these updated models wouldn't provide a great deal of utility, because it really entirely depends, again, on who becomes infected.
Operator, could you please put through the next question?
Sorry, next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Thanks for taking my question. We just had a protest outside the legislature here in Edmonton not too long ago, and hoping to get your response to those protesters. They're calling for for schools and gyms to reopen faster and for gathering sizes to be increased to 50 people. So just hoping to get your response to their concerns.
Sure. So I think that it's completely reasonable for people to look around and say, we don't see this big impact that the initial models suggested, so we do need to open up. And I think those are absolutely reasonable concerns, and we are having conversations, as we've talked about in the previous days, making sure that as we plan to reopen different segments and ease restrictions, the concern that I have is that if we do that too quickly, those earlier models can still come true. We haven't escaped the threat of the virus. We've simply, by all of our collective work, prevented rapid spread. And again, I say Albertans should be proud of what we've done. We have averted situations similar to what we had seen in New York. And even if you look at the numbers in Ontario and Quebec, where they had much more spread than we did, if we had had similar spread, we would have hit those probable numbers that we predicted in our modeling. And so really the important thing for people to know is that what we've done together is avoided a significant surge in a system need in severely ill people and in deaths. And so as we look to open up again, we need to make sure that we don't open so quickly that we simply defer that prediction that we saw of the high rate of ICU admissions and deaths, but that we actually avoid it. And so that in our reopening, we continue to manage and slow the spread so that we can enjoy the summer and enjoy it in small groups, enjoy it maybe in a different way than we typically do, but absolutely recognize that we need to be and are looking very carefully at how we can do that safely.
Operator, could you please put through the next question?
Next is Jason Herring with the Calgary Herald. Go ahead, Jason.
Hi there, Dr. Hinshaw. We're evidently doing quite well with our efforts to flatten the curve, but I understand that as soon as restrictions are relaxed, we face the risk of reigniting this fire a bit. You touched on this a bit already, but what guidelines are you following when it comes to an Alberta reopening plan? And do you have reservations about starting to lift restrictions in the upcoming weeks?
So as my team and I have been preparing recommendations for discussion with the Emergency Management Committee of Cabinet, those recommendations have been based on experiences of other jurisdictions around the world. We've looked at countries like Germany that have been ahead of us, both in the number of cases they had early on, but then also their decisions about reopening. We've looked at analysis that have been done by different organizations around the world that have pulled together examples of what has been successful in different countries in terms of containing spread. What are those kinds of factors that seem to be most important for having limited and manageable spread of the virus as opposed to explosive growth of an outbreak? And so we've incorporated all of those things in addition to discussions that I've had with my colleagues across the country around the factors that we collectively think are the most important for managing controlled spread of the virus. And so those are all things that were part of the recommendations that went forward to the Emergency Management Committee of Cabinet for decisions around how we would plan for slow opening. With respect to the question about whether or not I'm concerned, you know, I think that Albertans have shown remarkable fortitude and resiliency in responding to this, and I anticipate that we will need that in the days to come. So I'm hopeful that we can continue those core measures that we need to hold in place for many months, and those are the measures that will allow us to successfully reopen. So again, this will just be the next test that we need to come through together, and I'm hopeful that we will come through this next test as well as we have come through the previous one.
Excellent. We've got time for 2 more questions. Operator, could you please put through the next one?
Next is Carmen LaBelle with CTV. Go ahead, Carmen.
Thank you. Hi, Dr. Hinshaw. I'm wondering, how will it work exactly in the continuing care facilities with people being allowed one guest outside? Would you elaborate a little bit on that plan?
Sure. So to be clear, the current order does allow the possibility of an essential visitor. And so in the orders that have been in place ever since we first implemented visitor restrictions, there's been a requirement for each resident of a continuing care facility to designate someone who is their so-called essential visitor, and that's somebody who is the person who would be providing for their essential needs. So if their care needs cannot be met by the staff in the facility, we have allowed that ability for operators to allow in one essential visitor to provide for care needs that can't be met by staff. We have actually expanded that in the current order to include quality of life considerations, and that may be for someone, for example, who has severe cognitive impairment and for whom some of the remote visit options that may be supportive for others may not be for someone who struggles again with cognitive impairment. And so we are allowing that quality of life exception as well for essential visitors. And so the current outdoor visit allowance essentially says that any resident in a continuing care facility will be able to have an outdoor visit with their essential visitor and one other person. So they can visit outdoors with 2 people, so 3 including that resident themselves. The expectation is that they would have physical distancing in place, that they would stay distant from other groups. So if there are other residents who have visitors, that there would be at least 2 meters between each of those groups. And so that would have to be part of discussions with facilities because, of course, these different facilities, there are residents who have many different needs. And so we would be asking visitors to work with the facilities to make sure that they're not overwhelmed with people who want to come, especially for residents who have more complex needs, who may need staff to help them get ready for a visit. This might need to be arranged in advance. But we wanted to open up that opportunity as the weather gets nicer to have those visits in an outdoor setting where the risk of transmission would be reduced, but also making sure that those considerations of the facility's ability to support that are taken into account.
Excellent. Operator, could you put through our final question?
Final question is Sammy Hughes with the Calgary Herald. Go ahead, Sammy.
Hi there. Just getting back to the situation at Cargill, you mentioned that you're satisfied with the recommendation from AHS that it's safe to open. I'm just wondering, obviously with cases continuing to go up, you mentioned it's now above 800 workers at the site. What would you say to those who are concerned about going back this quickly after just 2 weeks to work there?
So one of the critical pieces that I've talked about before with respect to that particular outbreak is that when we look at a site in isolation from everything else that's going on around that site, we will never be able to fully control an outbreak. And so with respect to the workers at that site, knowing that many of them carpool to work, that there are many who live in households where it may be difficult to isolate from others if someone's feeling ill, I think that partly what we need to keep in mind is that when we are continuing to see new cases, it's not clear where those cases were exposed. And exposure in any setting can result in a new case up to 2 weeks after that exposure happened. So what I would say to workers who are wondering, is it safe for me to go back when this plant opens? I would say, Alberta Health Services has been working very, very hard to phone every single worker at the Cargill plant to make sure that they have the information that they need about the practices that will keep them safe and prevent exposure in any setting that they're in. And I know that Alberta Health Services has been working, again, with those employees, with the plant to consider what other methods of transportation might be possible to limit spread that might be present if many people are carpooling together. And with respect to the plant itself, again, it's really important to know that Alberta Health Services has been on site multiple times to ensure that they're aware of the restrictions that are in place. And I think the plant site itself at this point has been fully cleaned. And so the question would be making sure that employees know that they're supported if they're not feeling well, they're supported financially and otherwise to stay home if they're not feeling well, to get tested again. If somebody who was feeling well before now starts to get sick, that they absolutely should feel free to get tested again. And this goes back to some of the points I made earlier about making sure that we don't stigmatize those who have COVID or who are close contacts, because what that will do is drive that testing underground. So I think it's really critical, again, that every setting that workers are in be settings that are safe, whether that's the plant site, whether that's transportation to work, or whether that's the home setting, and that all supports that are needed to make those settings safe are being provided by Alberta Health Services and other organizations, or with respect to the work site, that's the employer's responsibility to make sure that work site is safe.
Excellent. Thanks for joining us, everyone. We will provide another update tomorrow afternoon.